In this video, we demonstrate the assembly and testing of a 3M Versaflo TR-300N Plus PAPR with hood. Upon completion of this video, you will be able to identify the components of a 3M Versaflo TR-300N Plus PAPR unit and hood, recognize the difference between poor and satisfactory levels of airflow using a flow meter, inspect, assemble, and test the PAPR unit, and attach the hood. The 3M Versaflo TR-300N Plus is a battery-operated powered air purifying respirator used when working in or responding to certain types of hazardous situations. When combined with the appropriate high-efficiency filter, headgear, and battery pack, the PAPR provides respiratory protection against particulate matter, including biological pathogens. It is not designed for and should not be used in situations involving chemical substances. Typical use cases for this PAPR configuration include hospital patient care or first receiver patient care. Always refer to the manufacturer's instructions for use and NIOSH and OSHA guidelines when operating equipment such as this. The system consists of the following equipment. The Versaflo 300 Plus blower unit. This is sometimes referred to as the motor. Waist belt. Breathing tube cover. Hood. A thin protective film may be present on the exterior and/or interior of the hood's visor. These should remain in place while in storage and be removed when the hood is in use. High-efficiency filter, battery pack, battery charger, airflow indicator. You should inspect each piece of equipment prior to assembly for any damage and replace broken components as required. During a training exercise or while performing maintenance and inspection, the individual assembling, testing, or providing suit support for a Versaflo TR-300N Plus PAPR should not require any additional PPE. You may choose to wear vinyl or nitrile gloves to protect the equipment from any residue on your hands. When operating in a hazardous situation, individuals providing support to those who will be wearing the PAPR should refer to the policies and procedures of their organization regarding any PPE they may be required to don. New filters are packaged in cardboard, labeled with the filter model number, PAPR model it will fit, and the expiry date. The filter is also labeled with the filter model number and the expiry date. Before using a new filter, check that it has not expired. Expired filters should not be used in response situations, but can be used during training. Filters used for training should be clearly marked. Prior to placing the filter in the PAPR housing, check that the outer rectangular gasket and the inner circular gasket are present and are in good condition. Make sure the PAPR is powered off. Inserting the filter while powered on may cause damage. Hold the PAPR so the filter cover is facing downwards. This will reduce the potential for contaminants entering the PAPR motor while the filter is placed. Push on the blue filter latch on the side of the PAPR to open the filter cover. Place the filter inside the filter cover of the PAPR assembly. When placed correctly, the magenta label of the filter should be visible through the exterior window of the PAPR housing. Reattach the filter cover by slotting the hinge tab into the hinge end of the motor unit. Then latch the filter cover in place. You should hear an audible click as it locks. Gently pull on the filter cover to make sure it is fully attached. Before attaching the battery, you should make sure it's fully charged. To check the charge status, press the indicator button on the underside of the battery. A fully charged battery will display 5 green LEDs. Fewer than 5 green LEDs or a single red LED means the battery should be charged before use. Check the battery and motor unit electrical contacts are clean, dry, and free of any obstruction. One end of the battery has a single tab, the other end 2 tabs, one connected to a release button. Check that these are clean and undamaged before attaching. Insert the single tab end of the battery pack into the slot on the underside of the motor unit. Push the double tab end of the battery into the motor unit until you hear it click into place. Confirm the battery is fully attached by gently pulling it away from the PAPR unit. Power on the motor via a single 2-second press on the blue power button on the top plate of the unit. The motor will beep and cycle through a self-diagnostic. The self-diagnostic will test the flow level, battery charge, and filter loading. Air should also start to flow from the outlet on top of the unit. After the self-diagnostic is completed, the current battery charge level and remaining filter capacity will be displayed. If the motor displays continuously blinking LEDs or an alarm sounds, a fault has occurred that will require resolution before the PAPR can be used. If you do not hear a beep or see self-diagnostic LEDs at startup, do not use the PAPR. The flow rate will also be indicated. The PAPR has 2 airflow settings. By default, the PAPR uses the standard flow rate. You can increase airflow to the high setting by pressing the blue top plate button twice, each press lasting less than 1 second. The green flow rate LED will change from 1 light to 2 when operating in high flow rate. To reduce the flow rate, repeat the double button press. The green LED will return to 1 light when the standard flow rate is engaged. To power off the PAPR, press and hold the blue power button for 2 seconds. Gently tilt the airflow indicator end to end to make sure the float ball is moving freely. Then check the gasket at the bottom end of the indicator is present. If the gasket is missing, misshapen, or damaged, the airflow test will be inaccurate. If connected, remove the breathing tube from the air outlet on the top of the motor unit. Hold the blue power button for 2 seconds to power on the motor unit. Allow the unit to run for about a minute in order for airflow to stabilize. The motor unit should be in a vertical position. Place the base of the flow indicator into the motor unit air outlet. Make sure the base of the flow indicator is flush with the top of the air outlet. The airflow indicator contains a number of zones into which the ball will float when the PAPR is running. Attached to the airflow indicator is a chart displaying the zone in which the ball should float based on your altitude and ambient temperature. If the ball does not reach or float above the designated zone for your location, do not use the PAPR unit. Refer to the manufacturer's troubleshooting guide. The PAPR is equipped with a low-flow alarm. This can be tested by simulating a situation where airflow is restricted. Power on the motor unit. Cover the airflow outlet with the palm of your hand, ensuring a tight fit. The motor should compensate for the restricted airflow by speeding up. Within 30 seconds, the PAPR unit will emit an audible alarm. The bottom LED bar on the filter loading low flow indicator will also flash red. After removing your hand from the airflow outlet, within 30 seconds the motor will return to a slower speed. The flashing red LED and the alarm should stop. If the alarm fails to sound and the filter loading low flow indicator does not flash red, contact the manufacturer's technical services. If the waist belt is not attached, thread the end of the belt through the slots on the rear of the motor unit. Belts come with 3 sliders to help with management of belt length and motor unit placement. Place a slider on each side of the motor unit to prevent it from moving along the belt. The third slider can be used to manage any excess belt material once it has been fastened on the wearer. Sliders should be positioned with the rounded side on the exterior of the belt. The breathing tube connects to the air outlet at the top of the unit via a bayonet fitting. Insert the end of the breathing tube into the air outlet so that the 2 small points of the bayonet fitting align with the air outlet's parallel slots. Twist the breathing tube 1/4 turn to lock the fitting in place. Check that the breathing tube is secure by gently pulling on the connector. To disconnect the breathing tube from the motor unit, invert the unit so the tube and air outlet are pointing downwards. This will prevent potential contamination of the air outlet. Twist the tube 1/4 turn to unlock the bayonet fitting and pull the tube away from the air outlet. The breathing tube connects to the hood via a quick-release swivel. Push the tube onto the air inlet on the rear of the hood until you hear a click. Check that the breathing tube is secure by gently pulling on the connector. Verify air is flowing into the hood by turning on the PAPR unit and placing your hand inside the hood to feel for air. To disconnect the tube from the hood, compress the blue pinch clip on the quick-release swivel and pull back on the tube. The 3M Versaflo TR-300N Plus battery-operated powered air purifying respirator, when combined with the appropriate high-efficiency filter, headgear, and battery pack, provides respiratory protection when working in or responding to certain types of hazardous situations involving particulate matter, including biological pathogens. It should not be used in situations involving chemical substances. Prior to assembly, inspect each piece of equipment for any damage and replace broken components as required. Ensure batteries are fully charged before use. On startup, if you do not hear a beep or see self-diagnostic LEDs, do not use the PAPR. Test airflow before use. If the flow indicator ball does not reach or float above the designated zone for your location, do not use the PAPR. After attaching the breathing tube to the PAPR and hood, ensure it's secure by gently pulling on the tube at each connection point. Power on the PAPR and check for airflow within the hood. Remove the hood's thin protective film on the exterior and/or interior of the visor prior to use. When needed, the airflow rate can be increased by double pressing the blue button on the top plate. Store in a clean, dry area at room temperature, away from potential exposure to hazardous contaminants. Filters used during training exercises should be clearly marked for training only if they are to be reused. Filters used for training should never be used in hazardous situations involving real contaminants. Always refer to the manufacturer's instructions for use and NIOSH/OSHA guidelines for specific information regarding filter, cartridge, or canister use, maintenance and storage, PAPR unit decontamination, cleaning and storage, battery maintenance.